that's the image that everybody sees somebody that is healed. That maybe this person is a vagrant. Once you say somebody is mentally ill, they feel that the person is a vagrant. It shouldn't be so. They are just two different categories.
Okay, and so would you say that someone who has bipolar disorder could not result into being a vagrant or being homeless? Because I practically have seen a situation where someone whom was having mental illness was left out of the home because of the danger they pose to other occupants of the home. And sadly, you might be surprised that it happens to be a family member of that particular home. But then after they've tried all they could,
Good.
they felt they've actually they're not getting help elsewhere. And well, as at then, my project had not commenced, and I had if I'd actually known more about this, I would have been able to help as at then. But then you could imagine such a situation. Then the person is left out, and the person wanders on the street, and all of a sudden everybody says, "Ah, Oti Yawere is mad," and then this is this. What would you?
That's one of the main challenges we have. Somebody that is mentally ill, it is so cost effective. That means it's costly to actually take care, manage that person effectively. At least some people. Let me say some people.
Okay.
So it is not so, but
Depending on the type of mental illness.
exactly. But in our country, we've been made to take a lot of responsibilities, to do a lot of things by ourselves. We don't have a very responsive government, so to say.
Okay.
So for
You mean in terms of mental health?
in terms of mental health, in terms of health generally, not to talk of mental health, because yes, in terms of health, we don't look serious. So in terms of mental health, which people don't even see as is part of health, people don't consider mental health as part of a complete somebody having a complete health in quotes. So they say it as mental health different and then physical health. No, they are intertwined. So that's the way I think our government or us as we are looking at it. But if you think that both of them, you cannot be mentally well without being physically well, and you cannot be physically well without being mentally well. So that's it. So, but coming back to this, this person, as I said, yes, there are some cases that they keep reoccurring. They keep reoccurring because when you want to manage a patient with mental illness, you have to, it's not only using drugs.
Okay.
You have to manage with drugs. You have to manage some physically, maybe ECT, but that's getting on the
medical side.
Then you also have to manage psychologically. You have to talk to the person, have sessions that you have physical engagement, talking with the person. Then also you also have to have apart from psychological treatment, you have to have some social treatments,
Support
treatment,
groups.
rehabilitation,
Okay.
where the person will be able to make sure that the person is functioning at least within his environment, no matter what the challenge of mental health the person has.
Okay.
So that's so that's the concept of this, this arrow. There's this arrow village system that
Okay.
no matter how mentally ill you are, you still have a form of rehabilitation. So the person can still be made to do something. So as in men are being able to, do it like a carpentry work or something. You must be engaged. If you are engaged, if your mind is engaged, you will be well.
Well, you as a professional feel they should be engaged. The general public has a different view about engaging them. You could imagine someone who has manic episodes with a sledgehammer, probably working as a carpenter, just like you recommended, and then probably being happy, working well, and then there's someone who tends to pose a threat to him, or probably a lot of these mental illness actually have triggers that bring up the negative part in them, and then probably I have seen a situation where someone said she greeted him, and then he did not answer, and that was why she was attempting to kill him. And then we're like, why? At first, I did not even know it was a mental illness. At first, I was first confused. Why would you greet someone, and because the person didn't hear you, or the person refused to answer? Let me quote her. He refused to answer me, and I love him so much. And the guy doesn't know you, and you try to greet him, he did not hear you. Or, okay, let's even use our word, refused to answer you, and then you want to kill. How do you feel engaging such type of persons? What if she's, okay, probably into catering or into, no, catering would even be far because she's dealing with food. Let's say she's into cleaning, and then she's carrying a mop stick or whatever, and then a young handsome man passes, probably the engineer on the site, and then she greets him, and he didn't notice her.
Okay, but okay, sorry. Before what I'm trying to say is that
Okay.
the treatments, that's the biological treatment, that's the using of medications,
Okay.
the psychological treatment and the social treatment, they go hand in hand.
Okay.
But of course, you would have ensured that the patient is mentally ill, mentally safe before you can engage in those type of work.
There must have been a kind of
a time of
sessions.
Exactly. The person would have been using the person would have been using medication. The person will still be on medication even when the person is working. And the person will still be attending clinic, still be attending the psychological sessions.
Okay, the likes of
cognitive behavioral therapy.
Okay.
The likes of what they call that. The most common ones that we use is cognitive behavioral therapy, where what you think, your assumptions,
the likes of psychoeducation, family therapy, psychotherapy
is being so on a constant basis. You really want to know what the person is thinking about, what the person will want to think about. If this certain thought come, how will the person react to it? That's what you tend to do in the psychological therapies. So you would have been able to say, okay, this person, you think as a psychiatrist that this person is safe,
at least safe to a certain extent.
Exactly. And if you feel that the person is not safe, because then you say that you don't recommend this for this particular person at this point in time. But all those treatments, they are continuous. They are ongoing and continuous. It's not as if you leave once you feel the person is okay, then you stop the medication. You stop this. No, they are continuous. They are ongoing. They are all going concurrently.
Okay. Thank you, Dr. Tosin Lawal. We're still on the mental health show with James Osuntoogun. You call me MC JERRYJAY. And it's been a swell time with our professional in the house, Dr. Tosin Lawal. Thank you very much.
Thank you.
You were talking about even when we feel the mental illness is gone, the medication and the therapy should still go on.
Yes.
Do you think bipolar disorder can be healed completely?
No. We believe that it's a chronic illness.
Okay.
It doesn't go away. Once you have it, once you have it, it doesn't go away. But the rate at which one have relapses, at which you have, exacerbation of symptoms, can reduce or can attenuate completely. Why we say that we are not sure that it can completely go away is that we don't know what one will be faced with in terms of stress, in terms of what causes in the first place, the genetics involved and all that. So that's why you can't say that once you have it, then you cannot have it again. What we just say is that if you are able to do so and so that we recommend, then you should have fewer relapses or no relapses at all, and then you should be able to live as comfortable as you should as a human being.
Okay, thank you. Dr. Tosin, how would you talk about? You spoke about genetics now. Do you mean that it can be transferred to the offspring,
Yes.
even if it's been treated initially? and probably the relapses are reduced to the barest minimum. When the person gives up an offspring, is it possible to pass it on to the next?
It is very possible. Very possible, especially, and the chances are higher from from parents to their offspring. So if a mother, if a wife, and the husband, both of them have it, the chances of them giving it to, chances of their children having it is higher.
Wow. Okay, what if it's just the mother or just the father that has it?
The depending on the closeness or the more genetics that is involved, so to say.
Okay.
Then
the more dominant.
The more dominant,
okay.
Or the more likely the offspring would have it, or the more that it will be present in the family. So if both parents have it, more likely, we say like almost 48% to 50% chance that the offspring will likely to have it. If the grandparents have it, there's a likelihood that even if it didn't occur in the children,
it will still occur in the
grandchildren. Yes. Then if a sibling has it, likelihood that one of the other siblings too can have it. Then if anybody in the family, there's a chance that somebody in that family too can have it.
Okay, just like in the likes of melanin disorder, also that is transferred from one generation to the other.
Exactly.
Okay. What would you say is exactly the cause of bipolar disorder?
Because we can't say that there's a particular cause. There's one thing causing mental illnesses generally. So we don't have a one point cause. Should I put it like that?
Okay.
For mental health generally, which includes bipolar that we are talking about.
Okay.
So usually we say that it is multifactorial, and the triggers for it to come about is also multifactorial. You can't pinpoint it to one thing, but usually we say that it could be genetics, as we've explained. It could be environmental, as in it could be
But environmental, do you mean human relation or just the climate condition?
I mean climate conditions, all these
so climate conditions, disaster,
all
cool.
these man-made disasters, natural disasters, anything that is not going well. Seeing somebody being raped, witnessing violence can be a trigger for it to come about. Then also it could be psychological. It could be things that have happened while one is growing up. Not having parents that are not there, that are neglectful. Having a mother that is not there, that is absent, and all those things too could have a role in bipolar illness. But the usual one, the one that is really more predominant, so to say, is genetics. The environmental one, that one can be controlled, that one can be at least, but the one that's, if everything is set, if everything is, as in, if the environment and everything is set, is the genetics.
Okay. And thank you very much. It's been a more enlightening period with you, and
thank you.
You're welcome. And if we're talking about the genetic structure, does it mean that people who have bipolar disorder wouldn't have a better chance at marriage, or would you advise people to avoid them when it comes to making offsprings with them, building a family with them, since we are at least 50% certain that it can be passed to the next generation? Could you say that is a way of trying to reduce a spread into the next generation?
No. Because it is treatable. Fine. If one has it might not be totally cured, but it is treatable. The person can have an episode and no longer have any other problems again. So it is treatable. It is. So what we advise is that...
Are you saying being treatable is different from being curable?
Yes, of course.
Okay.
Being curable, that means We are not sure that if everything, that all the genes, all the things that are involved, especially in terms of genetics, you can take it out. So that means you cannot cure it.